Welcome to San Joaquin Spotlight, a public affairs program featuring conversations about life in the central San Joaquin Valley. This program is brought to you in partnership between KFSR 90.7 FM and CMAC Fresno. I'm your host, Sevag Tateosian. Welcome to San Joaquin Spotlight. This week our guest is Tim Curley. Tim is with Valley Children's Hospital. Tim, welcome to the program.
Thank you, Sevag. Great to be here.
So last time you were on the program, we were in a studio at Fresno State.
Right.
A lot smaller than this.
Yeah.
What do you think?
I think this is fabulous. Yeah, great setting.
Thank you very much. Now your organization is Valley Children's, correct? For a while it was called something else. Now what is the official title?
So the official name of the organization is Valley Children's Healthcare. So at the end of last year, we did two things in one announcement. We announced going back to the name that we started with back in 1952 and that became synonymous over the decades with quality pediatric healthcare, and that's Valley Children's. And then we also announced the creation of Valley Children's Healthcare. So essentially the parent organization or the umbrella organization is Valley Children's Healthcare, under which falls now Valley Children's Hospital, Valley Children's Medical Group, Valley Children's Home Health, and Valley Children's Foundation, our philanthropic arm. So the bigger structure, the Valley Children's Healthcare, gives us a little bit more flexibility and more opportunities to provide more services up and down the valley throughout our 45,000 plus square mile service area.
So it was just the hospital at one time, correct?
You know, it was just the hospital. I guess going back to 1952, yes, it was just the hospital, and through the years we've certainly evolved. The foundation's been around a long time. Our home health service agency has been around a long time. The medical foundation is relatively new, and that's a feature that again gives us more opportunity to move as much of our services out into the community as we can, recognizing that with a service area that extends from Kern County in the south to really San Joaquin County in the north, there are families who have to travel a long ways potentially for specialized pediatric care. So we want to try to branch out and provide as much as we can out in the community. So the medical foundation gives us a little bit more flexibility to do that.
I want to, in talking about that point that you just made, so when I'm driving up to the mountains,
Yeah.
There's this beautiful, colorful building on the left-hand side, and it's the Valley Children's, the hospital, correct?
Right.
Do you have other hospitals? I mean, you just said you cover a huge area, and I know
Yeah.
from past conversations that you cover a huge area. Do you have one, is it just one hospital for the Valley, or do you have other satellite locations?
So clearly our anchor is the hospital in Madera. But beyond that, we have services and sometimes facilities in other parts of the valley. So as an example, we operate a very large level 3, highest level neonatal intensive care center at the hospital in Madera, but we also operate satellite neonatal intensive care beds in various areas, including in Hanford, in partnership with Adventist Health at Hanford Community Hospital, at St. Agnes Hospital, and then at Mercy Hospital in Merced. We also operate a number of pediatric subspecialty centers. So in Modesto and in Merced, and now recently in Bakersfield, we operate centers through which we rotate a number of our pediatric subspecialty physicians from the Madera campus to those locations so they can see families essentially in their home market. And what's particularly neat about Modesto and Merced is we also have pediatric subspecialty physicians there full-time. So we have a full-time pediatric cardiologist, pediatric gastroenterologist, and a pediatric neurologist in Merced and Modesto full-time. And then we rotate others.
You mentioned level 3. Can you, and without going into too much detail, but can you go into what that means when you say level 3 care? What does that mean?
Yeah, so I'm a little out of my wheelhouse on this one, but in California rates neonatal intensive care units by the level of service and the level of acuity or the level of illness of the children that can be treated there. So a level 3 would be the most serious or the most acute, level 2 a little bit less, level 1 even a little bit less. And then within level 3 there are a couple of of subcategories within the level 3. And we are the highest of the level 3, and we're the only one in all of Central California at that level. So that means in order to be there, we have to have a complement of services and types of physician specialties available all the time to be able to deal with the wide variety of needs that our neonatal intensive care patients are going to present when they get to the hospital.
What is your background? I mean, we kind of dived right away into the hospital, but
Yeah.
tell us a little bit about who Tim Curley is. I mean, how did you select this line of work? I mean, how did you get involved in this area?
Totally by chance. So I went to graduate school, got a master's degree in international relations, conflict resolution, moved to Washington, D.C. to hopefully find a job in that field of work. Wasn't finding anything. In fact, Sevag, I was delivering Chinese food on my bike. I ran into a cab door. Some gal opened a cab door as I was driving or riding my bike to deliver the food. I went over the door, landed on my back, and people my age in suits were walking up to me asking me if I was okay. And just the day before, I'd been offered a job with a healthcare consulting firm. And so I took it. I said, I didn't come to D.C. to deliver food. I took it, and I haven't looked back since. So I worked in D.C. for 4 years and then came out to Fresno in 1994 to work as the regional vice president for the Hospital Council of Northern and Central California, and then went to Valley Children's in 2006.
And you've been there since?
Been there since.
Great choice by you. I mean, what do you think?
It's worked out fabulous. Yeah, I kind of hit a point with the Hospital Council where I was looking to do something a little bit different. Didn't want to leave the Valley, and this opportunity came up, and I jumped on it. It's worked out.
Well, and talk a little bit about the Valley a little bit. I mean, are we in a challenging spot as far as care for children? I mean, if a child gets hurt, is access available for them?
I think the Valley presents a lot of different challenges. One, just the pediatric population generally in the San Joaquin Valley, in the Central Valley, tends to be sicker than the pediatric population in other parts of the state. If you look at kind of your core health status indicators in terms of the percent of kids who have asthma, the percent of kids living in poverty. Poverty is a big factor in all of it. The percent of kids that are either overweight or obese, the percent of newborns born prematurely. We have a lot of significant, just general public health challenges for kids. So that impacts their health down the road, and we certainly see the side effects of some of that in our own organization, and every other provider that's serving kids deals with that reality every day. And then beyond that, we've got the fact that I mentioned the poverty issue. A lot of our kids are covered by Medi-Cal. So about half of the kids in the Central Valley are covered by Medi-Cal. Medi-Cal is the state federal health insurance program for low-income families. And it is a good insurance product from the standpoint of the services it covers for the families and the kids. Mm-hmm. And there's very little, if any, cost-sharing responsibility for the families. So it's good for them. It just happens to be one of the worst payers out there for the providers. So it generally does not cover the provider's costs for providing services. So the challenge is always trying to find enough providers who are going to take Medi-Cal. And that's an ongoing challenge. It's been a challenge for years. It'll be a challenge moving forward. But that really does present some big challenges for the population and the providers taking care of those families.
And we don't have to get into too much detail about this, but since joining the team at Valley Children's, have you seen a lot of changes in this area? I mean, it seems like there's been a lot of changes in insurance and different prongs and different coverage.
There certainly have been changes, and some of the changes I've seen include, I think our area has gotten better at working together around kids' issues. I think our organization has taken a stronger leadership role through the years. You also have organizations like the California Children's Institute at Fresno State has done a fabulous job working on specific issues around the health and well-being of kids. So I think we've, through the years, our first 5 organizations, other community-based nonprofits, our county public health, we've slowly started to develop more capacity and more ability to work better together. So I think that's been a positive change for the work that we do at Valley Children's and everybody else around kids' issues.
The public, how can they help you? I mean, I'm impressed. So can I make a donation? How does that process work?
So absolutely, anybody can make a donation, and the easiest way to make a donation is to go onto our website at valleychildrens.org and go from there. It'll be pretty obvious once you're there how you can donate through our website.
And speaking of donations, I was excited. I read Be Sweet Citrus donated to your organization.
Yeah.
And then the Peters Foundation also donated to your organization. So
Right.
talk a little bit about what that project is for, because that project I hear is in Fowler somewhere.
Yeah. It kind of goes back to our commitment to try to make our services as accessible to our patient population. So one of the things we announced recently was in partnership with the Adventist Health System, and they've got a lot of services in Kings County, 2 hospitals. They've got 2 hospitals in Fresno County, I think South Fresno County, and a lot of clinics. We're partnering with them to open up an outpatient clinic in Fowler, probably sometime in 2017. And we will be the provider that provides the pediatric services, primary care and specialty care. And then the Adventists will come in and provide the adult services at the clinic. So we're really excited about that. It's right off of Highway 99. It's going to really improve access for those families in South Fresno County and North Tulare County and probably East Kings County. Be Sweet Citrus, a large citrus producer and packaging house in Fowler, donated $1 million.
That's impressive.
Towards that effort.
So can I stop you there? So
Yeah.
let's say that, you know, I could just imagine the employees at Valley Children's the day the announcement gets made. Are you high-fiving? I mean,
Everybody is absolutely thrilled. Yeah, because that doesn't come every day. That doesn't come every week.
not
or
in the
month or
sum
year.
of $1 million.
Yeah,
I mean
that's
a big check.
significant. That's a very significant contribution, a very significant statement by that organization, not only in support of our own organization and what we do and what the Adventists do, but probably more importantly for them, in support of their own employees, because they're clearly motivated in making sure that their employees have access to quality health care close to home. So I think they saw the real value in what the Fowler Clinic offers, and they wanted to be a part of that to make it successful.
So are we talking a separate new brick and mortar?
It'll be
mean,
a separate building. Yeah,
Okay.
and I can't remember the exact location. It's very close to the Merced Street off-ramp from Highway 99 in Merced. So it'll be a separate building, a new structure, and improved access to health care for that community.
So I read about that and I was excited. And then I read about the Peters Foundation stepping in. So is that same project?
Same project, yeah. The Leon S. Peters Foundation has committed $540,000. So between the two, over $1.5 million to support that project.
So if I was a fly on the wall in your office at the time that announcement was made, what did Tim Curley do when you first heard about those donations?
You know, both of those, it's just like, wow, that is really neat. I mean, to be able to get that kind of financial support just makes you feel like you're really working for a worthwhile organization for somebody to make that kind of commitment. And then just to know that that Fowler project now has that kind of momentum behind it is really encouraging.
You know, dealing with children, it's different than dealing with adults. I mean, how do you make your hospital more appealing to kids?
Yeah.
I mean, you know, it just seems different. When I've been to Valley Children's and I've been to some of the other hospitals, but all of them are great, but
Sure.
there's a different feel at Valley Children's. A different vibe maybe is the word I'm looking for.
Yeah.
What's the difference? I mean, how do you make it more appealing for kids and parents?
Yeah, I think it begins with a commitment to make sure that everything that's done at that hospital is done through the lens of what's right for kids. That's why that hospital was conceived and built in 1952, and that's what drives that hospital today. And you see it in a lot of different ways, Sevag. You mentioned just the physical structure. It was built to be no more than 2 stories, approaching it from the front, so it's not meant to be intimidating looking. It's got different colors, so it's kind of a fun little color scheme. There are lots of different children and animal sculptures out front. The children are clay sculptures, the animal sculptures are topiaries. Our plants are shaped into different animals. So, you know, just from an aesthetic standpoint, it's meant to be as child-friendly as possible. There are play areas for kids, both outside of the hospital and inside the hospital. And then everything that happens, Sevag, inside of that hospital is driven by what makes sense for the kids. from the training that our physicians go through that work at the hospital, the training that all other clinicians go through that work at the hospital, the equipment that we use, whether it's very small wheelchairs for kids, whether it's feeding tubes, medication tubes. They're all very different from what you would find in an adult hospital. The bed sizes, the operating rooms, I mean, everything is set up to deal with kids, from the staff to the equipment to the supplies to our quality measures to the medication. You know, we have to compound and slice and dice through medication just to make sure that our kids are getting the exact right dose, because the adult-sized dose is going to be very different from a kid-sized dose. And kids change through the years. You know, we serve kids ages 0 to 18, but even beyond that for some of the kids. And even within the 0 to 18 timeline, there are a lot of changes that kids go through, obviously, between 0 to 18, a lot of growth physically and emotionally. And so you have to be prepared to deal with.
Talk a little bit about the building. Where is it located exactly, the hospital? Because I know that it's located on the way to the mountains. It's off to the left-hand side there on a big piece of land.
Yeah, so if you're in Fresno and you want to get to the hospital from Fresno, you just head north on Highway 41, and just as you cross the San Joaquin River, your first exit is going to be Children's Boulevard. Get off on Children's Boulevard and you'll see it. If you're traveling from Highway 99, probably the quickest way is taking Avenue 9 in Madera County and heading east. And it's about 15 minutes east off of, right on Avenue 9.
And do you take walk-ins? I mean, how does it, is it the same style as a normal hospital? I mean, if you know, God forbid my child gets ill, real ill, and I need to take him somewhere, do I just walk up? I mean, do you have like an emergency area? I mean, how does that work?
We definitely have a very active emergency department. We're the only pediatric emergency department in all of Central California. We're obviously the only pediatric specialty hospital in the area as well. So we have a very busy emergency department. So we see a lot of kids through the ED. And like any hospital that operates an emergency room, we're not going to turn anybody away from the emergency room. But then we also see a lot of patients based on referrals we get from primary care providers in the community. So the pediatricians or the family practice physicians and or others who are seeing these kids probably are often the first ones to notice something may be awry with the health of the kid, and it may require further examination, and then that provider will make a referral to the hospital. And so we wind up seeing a lot of the kids, the referrals, and then also a lot of children just through transfers. We have relationships and partnerships, Sevag, with I'm guessing just about every hospital in our entire service area. And those relationships kind of guide when they get a patient who comes in, a pediatric patient coming in with a condition that the hospital thinks needs a higher level of care, then there are protocols in place that make it very easy for that hospital to either call us up for some guidance or just to execute a transfer and get that child to us as soon as possible. So we also get a lot of children that way as well.
Seeing sick children or children going through tough times, it's tough. I mean, it's tough emotionally. Why do you do what you do? And why do you think people, I know you can't answer for everybody at your organization, but what makes you say, I'm going to get up and I'm going to keep doing what I'm doing? And here's why I asked the question, because I've seen you off camera, and every time I see you, you're running from one meeting to another meeting, you're meeting with this person, and I mean, you're moving and you're shaking. Why do you do what you do?
Yeah, I think what drives me, as you said, probably not too dissimilar from what drives everybody else there, and that's just a real passion for making the lives of kids, many of whom are in real difficult situations, better, somehow, some way. I'm obviously not as close to that as the clinicians are, but it still drives me, Sevag, and people are in positions like mine at the hospital. I think there's just a real genuine commitment and a lot of satisfaction that comes from being able just knowing that somehow, some way, you're positively impacting the lives of children.
Talk a little bit about, I was online and I saw something about a residency program that you're offering. Talk a little bit about that residency program.
Yeah, sure. One of, I think you talked about challenges earlier, and I think one of the biggest challenges impacting all of us in the Valley is a shortage of physicians. We for years have not had an adequate number of both primary care physicians in particular and then specialty physicians in different areas for a long time. Central Valley has just been a really tough place to recruit physicians to. We feel, and a lot of other people do too, that the best way to address that physician shortage is to grow your own. And there are existing residency programs here in the Valley. But we felt that as the only children's hospital in the Valley, it was important for us to play a bigger role in training the pediatric physicians of the future. So last year, we announced our intention to create our own pediatric residency and fellowship program.
Congratulations on that.
Thank you very much. And then earlier this year, we announced that we're going to be doing it in partnership with Stanford Medical School. So we will be essentially the accredited or designated residency program, we being Valley Children's Healthcare, but to the extent that we need support from a medical school, we'll be working in collaboration with Stanford Medical School. At the same time, we'll continue to do all the training and education that we've done for years. Right now, there are probably about 190 either medical students or residents receiving training or education at our institution. And we'll continue to do that. But now on top of that, we have a new pediatric residency program serving the needs, hopefully, of families and kids in Central California. So it's exciting. So our hope is by this time in 2017, we will have recently enrolled our first class of 12 pediatric residents and fellows. I'm not sure the timing. It could be as early as next year, I think. But we're really excited about it.
Has Valley Children's always been growing like this? I mean, I see, for some reason, the past like 3 or 4 years, I'm seeing more news about Valley Children's Hospital. I mean, based on your experience, has it always been growing like this, or has the past couple of years, I mean, it's just expanding more than before?
Yeah, so I've been there since 2006, and since 2006, we have seen a lot of growth. I think for the first 4, 5, 6 years, a lot of the growth was on campus. So it was the West expansion we did probably 3 or 4 years ago, where we added space to our emergency department and our surgery units and our pediatric intensive care unit. Since then, I think a lot of the growth has been focused externally. I mentioned a pediatric subspecialty center in Bakersfield, so we opened that earlier this year, and so that's a new resource or service. And we're constantly engaging with other providers up and down the valley and even over to the coast. I think it's relatively new, probably the last 3 or 4 years. We entered into a partnership with Sierra Vista Hospital in San Luis Obispo, where we are rotating some of our pediatric subspecialty physicians over there as well. So I think what you've noticed recently is an obvious commitment on our part to try to make sure we're meeting the needs of kids up and down the valley as best as possible, and part of it involves taking our services out to those kids and to their families.
Earlier in the interview, you were talking about how you wanted to stay in the Valley. What makes this place so great? I mean, what is it about the Valley that obviously, you know, you're in love with the place. Mm-hmm. What is it about this place?
That's a great question. You know, I think just speaking personally, I love the mix between urban and rural. It has a very strong sense of community. I think there is a lot of pride in saying you're from the Valley and being in the Valley, and kind of a lot of pride that comes with sticking it out too, because it's not an easy place to live, and obviously there are a lot of families who really struggle. So I think though it's almost like a challenge. It's a challenge from the standpoint of it's great, it could be a lot better, and I'm committed to doing my part to try to make it better.
We're running out of time this week on the program. I can sit for hours with you and talk about Valley Children's, the Valley, but every guest on San Joaquin Spotlight gets a magic wand. And so, Tim Curley, you have an opportunity to have this magic wand. With this magic wand, what is your wish?
My wish would be that we are able to make a very meaningful, measurable impact on the health status of our kids. And again, a lot of it is driven by poverty. So if there's a way to just improve the overall well-being of our families, both economically and health-wise, that we would find a way to do that. And there are a lot of neat partnerships in place right now, but just to wave the wand and make our kids healthier would be fabulous.
How can people get in touch with your organization? How can they donate? Be Sweet Citrus, Leon Peters Foundation did a wonderful job donating some large amount of money, but people who want to donate to your organization, how can they do it?
Yeah, so the easiest thing is to go online, valleychildrens.org. But if you're somebody who's a lot more comfortable picking up the phone and making a call, you can just dial 559-353-3000, ask for the foundation, or you can ask for me. It doesn't matter. We'll take your call or your outreach any way you do it.
Last question. In 5 years, where do you see Valley Children's?
I think in 5 years, it's going to continue to go move down the trajectory it's on right now, which is moving or offering as many services as possible in different locations up and down the valley.
Tim, thank you so much for coming on the program this week.
Thanks for the opportunity.
That's all for this edition of San Joaquin Spotlight. To the volunteer crew that make this production and every production possible, we couldn't do this without you. We couldn't do this without our audience members listening to the broadcast on 90.7 FM KFSR Fresno, and those of you watching on CMAC, Comcast 93, and AT&T 99. We also couldn't do this program without great guests like Tim Curley and organizations that are doing wonderful things in the Valley. So Tim, thank you again.
Very much appreciate the opportunity.
Tune in next week to a new edition